Guys, what's up? It's Tony G here. Um, I want to make a video about my pre-op journey. What I went through to get to my actual surgery date. Just a little information as of where I'm at now. Um, Today is the 2 week mark of like post-op, and I'm down about 21, 22 pounds. Things have been going good. I'm gonna do a video of all that stuff and what I've been going through the past 2 weeks um, in another video, just because this one's about the journey leading up to the surgery. This video might be long. I can't really promise anything. I tried to do like a preliminary video that was like way too long, and just way. I'm a talker. I get too much into detail sometimes, or I kind of go down the rabbit hole of too much. So this is just like a warning now that this might be at least a 15-minute video, maybe longer, 20-minute. I don't know. But we'll get through it. So my journey started in I want to say March of last year. Yeah, March of last year. Um, what happened was I had bronchitis. I learned that I had bronchitis, but ultimately what happened was I was coughing and whatnot. I was in the shower and I coughed really hard and felt a pop in my side. Didn't feel normal. Was excruciating. Went to the hospital. They did all different types of tests and stuff, and ultimately, excuse me. Apparently, I tore my oblique when I coughed, which I thought was interesting. Um, but on top of that, uh, they said like, yeah, you definitely have like a deep-rooted bronchitis. Here's a um, corticosteroid or a bronchial inhaler, um, and some pain meds to deal with the tore muscle down there. Um, go home, do my thing, etc. Fast forward a month later, I had taken the medicine, felt better, all that. Um, a month later, I felt pain in my upper left shoulder and like tightness in my chest, and of course, WebMD. Um, hey, you're either having a heart attack or it could be like a couple of other different things, but everything's like heart related. So I was like, crap. I was like, let me go to urgent care, see what's going on here, because I wasn't really looking to go to the hospital unless it was like an absolute emergency, which I guess now looking back on it really was, but I was stupid about it. Um, so I went to urgent care. They did EKG. They're like, your waves are off. They're not good. Um, and they said ultimately this is either going to be something's wrong with like a blockage or something in your heart, or you have pericarditis, which is inflammation of the sac around the heart. Because they said the symptoms are very similar to those other things. So sure enough, I said okay, and they were like, we're not even going to do the blood work or anything here. We'd rather you just go to the hospital, get it all done there, and be in a sense like one stop shop, get it all figured out. But the doctor was funny because she was like, she's like, whenever it's all figured out and you're better, can you come back and let us know what it was? Because I'm really interested to see. And I said, sure. Um, Go to the hospital, do all the different tests, blah, blah, blah. Sure enough, they're like, your inflammation factor is like really, really high. Um, were you sick at all recently? I explained, the month before I had the bronchitis. And they're like, okay, it must have deep rooted and it went to your heart. And ultimately, you have like a virus or a bacteria in your heart, and that's what's causing this inflammation. Um, so they gave me really powerful NSAIDs, um, and all that stuff. And in that process, though, they also mentioned um, all the different issues with my blood work, from top to bottom. And that was when I made the decision okay, it's time I go get this uh, weight under control, whether through diet or whatever not. And so, went ahead with all that and went through um, the process of you get for me when I met like I ultimately decided this at this point we fast forward to like May. That was when I was able to get my first appointment with the bariatric group. So beginning of May, meet with them, have a discussion about the type of procedure that would be best for me because of my age, my activity level, all that. Ultimately, we decided on the vertical sleeve, and uh, excuse me. We reviewed the information of my history, and he was like, "I also need you to see a hematologist because you." I informed him that I had the thalassemia trait because that was always like a big thing in my family. It's called like the Mediterranean disease. So I went to a hematologist for that, and also my mom had mentioned um, that she had the factor five blood. It's called factor five. It's a blood clot. It's a blood clotting trait, or it's a genetic mutation. And so I had to go to a hematologist for all that, and that was where my journey varied from a lot of others because everyone basically goes for an endoscopy, the mental health check, um, the cardiology, all that stuff. Like those are standard uh, checks for the list for that. But my hematology stuff was different than most. Um, a lot of the time was spent trying to get an appointment from the hematology, an appointment from the vascular surgeon, because they wanted me to get an IVC filter put in my inferior vena cava because of the blood clotting stuff, and I really didn't want to do that because all the information I found was anyone that had that done, their chance of death during the bariatric surgery was doubled. And I said to myself, I'm not going to. If it comes down to that, I'll try and do my best to do what's necessary to try to lose the weight, um, through exercise and watching what I eat. Even though looking back on it now, like really this was always going to have to be my path because um, the doctor explained to me when they did my ultrasound and stuff that my stomach was very big. It was part of the reasons that I was able to eat. Like if I went to Chipotle, I'd have 2 burritos. Um, Even after when I was younger, I did do weight loss dieting and stuff, and I lost like 60, 70 pounds. Never could keep it off because I would go to the gym, do a really good workout, but after the gym, my appetite was like ridiculous, and the amount of food I would eat was ridiculous. Um, so ultimately, I needed a surgical intervention to reduce my stomach size, so to get rid of the additional appetite that I had, but also shrink the size of my stomach because it could just hold too much food. Um, and yeah, so the surgery was probably always in the works for me, but it was just obviously not realizing it at that time and not knowing the information that I know now. Um, that said, um, ultimately, what ended up happening was the vascular surgeon cleared me of needing the filter. He said because I was young, never had any issues with blood clotting, and my mom had her issues after she was like 50. So he's like, that's not really going to be a concern. He said, what we'll do is we'll just have the hematologist recommend heavier blood thinners for a longer period of time, and that should take care of the situation. So that was the recommendation from him to the bariatric surgeon, which he said he was okay with and could agree to because ultimately it's like the liability shifted to the the vascular surgeon and it wasn't in his hands. And the hematologist also was taking some of the liability as well. Um, so fast forward now some more. Um, the one thing that I had with the endoscopy that was different from others was I ultimately was found to have um, I had a fungal infection in my esophagus, which had to be treated. It was 2 weeks of antifungal medication. And he also told me to get tested for HIV because he said fungal infections are usually associated with um, immuno issues or immuno disorder stuff. I had already been tested for like every genetic thing and every immuno thing under the sun when I went to the hematologist, so I knew that I didn't have any of that stuff. They tested me for all the other things as well. So I explained to him, I said, is there anything else that can cause this? And he was like, well, he's like, did you have any sort of corticosteroid or anything like that? And I explained back in March of that year. And he was like, it's definitely possible. He said, because this is like a long built up thing. So he said it might fit that timeline, and that's totally plausible. So, you know, that was ultimately the cause of it. Now we know. But yeah, so I had the antifungal medication I took for 2 weeks. All that went well. Did my pre-op testing stuff in beginning of January. Everything else, as far as like the standard staples of going for the surgery, were already accomplished, taken care of. But then a sad thing happened the end of January. Ultimately, my mom had passed away from a complication of pneumonia. But she had always had numerous health issues. And all of them were weight related. She was a diabetic for like 28 years. Had every complication of diabetes that there really is. Like, very sad. She lost eyesight in one eye, and she had diabetic neuropathy. Couldn't really walk. She had a heart attack 2 years ago. So just a lot of pain and suffering on her part. And I always felt bad about, because she was one of those people that, like, she was definitely younger than her body, like, mentally. So she was, like, ultimately trapped in her body because of the bad decisions throughout her life as far as food was concerned. So that was also a driving part of this journey for me, because it was like, if you don't do this, this is the road you are looking at. Almost like, kind of like, I hate to say it, but like a Christmas Carol, like where, um, I'm getting like that image of, if you don't change, this is where you're going to go. And, but my mom in the beginning was kind of like, can't you just like do the surgery? I mean, can't you pretend you had the surgery and just like pretend like your stomach's smaller? And it's like, I get what you're saying, but it doesn't work like that. And it's, is ultimately a mind, is it a battle of the mind in those scenarios? Yes, but I knew that I couldn't do it. And also, like I said, with my stomach size being what it was, physically I just would not be able to hold up long term. But I think as time went on, because she was with me throughout the whole journey, she understood, like, this is probably the best thing for you. I understand it's a more extreme measure, but at the end of the day, it's going to help you not get to where I am. And I think she understood that. And definitely near the end, some of our last conversations were really about that stuff, and me staying the course and completing this. And I feel like she had an idea like she wasn't going to make it or something. And she was kind of like buttoning up her ends. And yeah, just a very, looking back on it, it was all, everything kind of happened in a very interesting way, that it was like, I mean, whether you're religious or not, everything does happen for a reason, and everything happens the way it does for whatever the reason. But everything just kind of fell in line in such an interesting way. And on top of that, um, so after my mom did pass and dealt with this thing, I ended up meeting with the surgeon probably about a week and a half after. This was like the pre-meet before the pre-surgery meeting. Like there's two meetings right before your actual surgery. So my one meeting was like, say, on like the 2nd, and the other one was on like the 11th. And my surgery is the 20th of February. So I told him the truth. I said, like, listen, my mom passed away, and yes, it's been hard and stuff, but I know that she wanted me to keep the course, and I feel like I have to, because if I don't, I don't know what other things in life are going to get in my path that will prevent me from doing this. And I've been through such a battle and such a long run with this whole thing, well over 9-10 months from the start to finish. And he said, no, I understand. And he said, if you feel that you can't do it, we'll cancel and we'll wait. He said, but he's like, if you think you can do it, I'm 100% behind you. And so we kept the course, and everything up into the surgery went really well. And I'm grateful for the staff and him and all the people that worked with me through it, and also my family, my brother and my nephew were very helpful in making sure I was able to get to the hospital and all that stuff, and everything just went really well. But yeah, so I I don't think I'm really missing anything else as far as the journey. If you have comments or questions that may bring up something that I may have missed, I'm more than willing to answer. I'm just trying to. It was a long journey, and really like remembering all the details is hard, and also I don't want this to be like an hour-long video, so trying to keep it relevant and I'm not going to say short, but relevant and sweet is kind of the important part. But also, I'm hoping that some of the information I gave might help somebody. YouTube's been a great avenue for information about all of this, and I'm just hoping to add to it and give a perspective, and also like from a male's perspective, because I've only seen a couple of guys really document their bariatric journeys, and um, I'm just hoping that my stuff might be of some help to someone. Like I said, comments, questions, please ask, and I'll do my best to answer what I can. Um, is it an easy road for everyone? No, and it's probably not going to be an easy road. It's not meant to be. This is a procedure that you're going for because everything else either doesn't work or you can't do that. Um, but I feel, especially now that this was one of the best decisions I ever made for myself in my life, and I hope for all those that go for the surgery after I have, and for those that for the years to come that go for it, that this is the best choice that they made, and that they lead a healthy life after it, and really make the changes they need to be healthy, for their friends, their family, everyone, and yeah, thanks for listening to my story, guys, and like I said, please, any questions, ask, and I'll do my best to answer. Thanks for watching. I appreciate it. Bye bye.